All right, let's take a deeper dive now into exactly how damaging this smoke can really be. Let's bring in Dr. K Varma, an epidemiologist who served as the senior advisor for public health for New York City's COVID-19 response, joins us live. Dr. Varma, we're seeing those masks again. First of all, talk to us, what is in this smoke that is so potentially dangerous?
Yeah, and one of the real scary things about wildfire smoke is that it contains a whole mix of different particles. The ones that physicians care about and worry about the most are these really tiny particles, and they're referred to as PM 2.5. Particulate matter that's small, that's incredibly small, about 1/10 the size of a piece of hair. And the reason those are most concerning is they go right through your nose and mouth and into your airways, and then they go even in from your airways into your bloodstream. So in the short term, people have a lot of respiratory complications, cough or difficulty breathing. But over the long term, they can also cause things like heart attacks and strokes.
All right, so it's really the inhaling of it, right, that's doing this harm to our body. So obviously we know the lungs are being hurt, but again, you're saying there are other parts of our body that they really can face some serious damage because of this.
Yeah, we don't know very much about the short term. That is, if I go and spend a day outside, what is my risk immediately? But there is a lot of data, incredibly good, high quality studies done from all over the world showing that long term exposure, like getting exposed to this for weeks and months and even years over time, causes somewhere on the order of about 10 to 15% of all heart attacks around the world. This type of smoke and smog is really dangerous. So, I think the message to New Yorkers is obviously take it very seriously. Wear a mask. If you have any respiratory conditions, make sure you have a good stockpile of your medications. You know how to get to healthcare if you need it. Work on improving your indoor air quality if you can afford it. But we really need to be thinking about the long term. How do we prevent these fires in the first place?
Well, so Dr. Varma, as we see some of this video, we see some people with masks, some people without masks. As a physician, would you be wearing a mask outside right now, knowing what conditions are like, even though they are starting to improve?
Oh, absolutely. That's exactly what I've been doing. I live in New York City. That's exactly what I've been doing the past 2 days when I've had to ride the subway to other places. And the reason is very straightforward. I mean, these masks are designed to filter these types of particles. And I know that, COVID started this war where people tried to argue about the risks and benefit of masks, but this is incredibly well established. All it takes is, put a mask over your face and see how your breathing is compared to not wearing one. And you'll notice the difference. And the other way to notice the difference is that when your eyes get irritated when you go outside, it's because they're not covered. So I would really encourage New Yorkers that if they're going to spend time outside, use the highest quality mask you can, one of those N95s or KN95s.
All right, that's what I wanted to ask you next. My last question for you. The type of mask then does matter, because we know during the pandemic we learned that the cloth masks that everybody was initially working didn't really make a huge difference when it came to COVID, and it sounds like that's the same with this potentially toxic air.
Well, I guess the one point I would make is that any type of fabric you can use to cover your nose and mouth is going to help keep out some particles. With COVID, all we're worried about are these really, really tiny particles. With smoke, while I told you that we're most concerned about those tiny particles, the bigger ones too can cause irritation, right? Those can make people wheeze, those can make people cough. If you're otherwise in perfectly good health, that's probably not a concern. But if you have asthma or any other type of lung disease, that could make it worse. So I would say that covering your nose and mouth is important. The best thing to do is obviously to use the highest quality mask, but it's very likely that any type of covering is going to help you at least a little bit.
All right, that's good to know. Excellent news we can use. Dr. K Varma, thank you so much for your time.
Great, thank you.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.